proposals. Do you have any kind of response? Is that okay if I?
Absolutely it is, sir.
Is this in reference to the public comment that was made on the first three?
On the governors, on your two proposals.
Excuse me. We engaged in a very lengthy stakeholder process this spring, and certainly we received some very passionate and detailed feedback from many folks, and a lot of that feedback was relatively similar to what you heard today. And so we are certainly taking all of that into consideration as we move towards the May revision. We hear the concerns specifically regarding rates, I think is something that we've heard a lot about. We've heard some concerns regarding access. Those are things that we are not blind to. I think as we look at the May revision and we come up with our proposal, not only will we consider those, but we'll also take into account, where we are at fiscally, which is always a concern. And, we don't have our May revision revenues at this time. And so, it's always about, this budget process is always about, the funding and the funding priorities. And so that's something that we will weigh as we look at the comments that we receive from folks and kind of where we're going with our proposals.
Well, we use a term called trial balloon, and so you say, well, this is something we might propose, and then you get all the feedback, and then you say, okay, well, maybe we don't do it because it was rather significant pushback. So you back off and you say, okay, maybe next year, or how do we modify it? Is that what you're?
So one thing I would point to is, as we moved through the stakeholder process, we heard a lot of concerns from folks in the field about the idea that this could happen as of July 1. That was a really strong concern from a lot of providers, and so we released additional information to the field that we were looking at least a one-year transition, and that these changes would not happen immediately, and that we respected that there would need to be a transition process. So I think we have certainly, in response to feedback, been evolving how we both present this and think about all the different possible repercussions of the changes that we make as we go forward.
Thank you. Thank you, Ms. Holmes. Thank you, Madam Chair.
Thank you very much for raising that, because I think that goes to your earlier point, Senator Morlock, about stakeholders are being asked to react to an already cooked, presented proposal, as opposed to being invited in on the front end with a kind of a blank slate and being asked, how would you reform a system if given the opportunity? So I think that's why you get more of a reactionary kind of response. So thank you for bringing us back. Thank you very much. We will move on to issue number 5, which is an oversight conversation around CalWorks childcare, and ask that the following panelists join us: Mr. Bland from Social Services, again, Kim Johnson from DSS, the LAO's representative, Finance, and Mr. Mecca representing the Welfare Directors Association. LAO. Thank you. Mr. Bland, you're going to get us started.
Good afternoon, Chair Mitchell and members. Todd Bland, Deputy Director of the Welfare to Work Division at California Department of Social Services. I'll be really brief. Child care is a critical work support for the families in CalWorks that need to participate in the Welfare to Work program. I'm going to turn it over to Ms. Johnson to be the lead testifier for CDSS on these issues, and I will also make my apology that I have another event and I will need to leave at 1. Apologies.
Appreciate it. Thank you.
Good morning. Kim Johnson, California Department of Social Services, and the agenda does a good job of outlining the background of the CalWorks childcare stages, so I won't go into that area unless there are questions, and I'll jump into question 1 if that's the pleasure of the
That's fine.
group. Okay. So CDSS has actually been involved in a number of efforts over the last several months. We've developed and launched a brand new site visit protocol with our county welfare departments. We've done a lot of stakeholder conversation and meeting directly with current and former CalWorks clients. We've also identified provide a number of horizontal integration efforts that would support our clients going through the process. On that last point of horizontal integration, the main point of that being serving the client holistically and improving the outcomes of the client and minimizing administrative burdens. So some of those examples that we've discussed related specifically to childcare have been developing streamlined application processes, simplifying forms, and thinking about how data systems interact with each other between the county welfare departments and the alternative payment program administrators. We've also, as you heard earlier today, been part of the AB 104 work group that focused on administrative efficiencies. As you heard, there was a recommendation to dig into kind of the CalWORK Stage 1 to Stage 2 transfer issues a little more, and we're happy to work with stakeholders in the Department of Education on that effort. Again, hearing directly from the clients, their experience directly. We've met with Parent Voices, for example, and they explained to us some of the issues that they were experiencing, not being aware of the availability of childcare services. The amount of paperwork was burdensome to them, they indicated, some duplicative processes. And they also, in terms of success, demonstrated when they were able to access childcare the significant impact that access had to their successful transition to self-sufficiency. And also in terms of getting client feedback, as the agenda notes, part of the RAND study and evaluation that will be forthcoming includes some questions directly to clients related to their access to childcare. So we look forward to sharing the results of that with you in the future. We are also embarking on a childcare study. The RFP for that study, request for proposals, has just been released last month, and that will provide a data set related to the demographic characteristics of those accessing childcare subsidy, not only within the CalWORK Stage 1 system, but also with CDE's programs. So we're looking forward to sharing those results with you when they're available. We've had a couple of different efforts related specifically to forms and the actual intake forms that clients have to experience when they walk into the door enrolling into Stage 1. So we have simplified and streamlined some of those forms in terms of intake, again, using stakeholder feedback. The reporting forms that the counties use in terms of how many clients are actually served in Stage 1, we've also revised so that we're now better reflecting the caseload served as opposed to the payments being made to the child care providers in those experiences. And our most robust effort, I would say, has to be, again, in the launch of the site visits themselves. So we're just beginning, starting in August. We visited 6 counties thus far. We have really focused in, again, on that intake process and the transfer process to Stage 2. Some of the findings and common themes we're seeing across those are the how and when clients are getting connected to childcare throughout the CalWORKs enrollment process. So we've actually observed CalWORKs orientations. We've observed the OCAT, or the online CalWORKs appraisal tool, assessments that are happening with the clients to identify what needs they're needing there. And we've really, in seeing those, seen how the language makes a difference. So for example, in Marin County's orientation, they're very intentional, telling the client that they can receive help in finding and paying for childcare services. So we think that we'd like to share that as a best practice. And we're also revisiting the points in time in which childcare is offered to the client, understanding that the needs of the client are changing throughout the CalWORKs program. We also dug into client application and notification processes. So there's just a variety of modalities that counties are using. Some of the counties allow for a mail-in of the child care application package. Others offer in-person assistance. Others do offer some phone assistance also for the recertification process. There's some variance in the amount of time they allow that process to occur across counties, so we're looking at that a little bit more as we go out on additional visits. Contra Costa, we believe, has a good practice of when they're notifying the client on any changes to their child care services, they also provide that same letter to the child care program so that the child care program is also supporting the client in responding to keep their child care enrollment continuing. Counties and clients have identified that the child care approval process is too lengthy. So there are actually some very interesting, promising practices counties do to rectify that issue. Sacramento County provides on-site child care at the county welfare department to support the child care needs while the client is in orientation and so forth. Marin and Orange counties both offer immediate short-term access to child care to, again, allow the client to participate. In Stanislaus County, they purchase childcare slots at a nearby childcare center to allow for drop-in childcare. So again, we're interested in thinking through the information that's currently required in the full childcare enrollment package as opposed to these immediate and short-term packages to see if there's some additional simplification that can occur. And then finally, childcare access in general, clients' access in general to the childcare system. In every single county that we visited thus far, they are connecting the client to the local childcare resource and referral agency to help find childcare when that's a need. We also heard both from the county welfare departments and the alternative payment programs and R&Rs that there was more co-location in the past, and due to cuts that happened in the previous administration, they aren't able to offer that co-location of service as much as they had in the past. So in terms of next steps, we will continue to conduct additional site visits to learn more about the processes and best practices and share those with the counties themselves. We'll continue to provide technical assistance and determine if there's any additional policy guidance that we can provide at CDSS, and any potential changes to regulations that would support the process. And we're just committed to working in partnership with the counties, the alternative payment programs, the Department of Education, and of course the clients and other stakeholders to identify ways we can strengthen the CalWORKs Child Care Program.
Thank you very much. Next, we'll hear from the LAO.
Ryan Woolsey with the LAO. Nothing to add at this time, but available to answer any questions about funding and caseload for childcare in CalWORKs.
Appreciate that. Finance, Mr. Lee. Mr. Mecca.
Thank you, Madam Chair. Frank Mecca, Executive Director of the Welfare Directors Association. And Ms. Johnson talked a lot about the state-county efforts, and I won't sort of restate a lot of that, but I will say that getting as many people who need childcare is a very high priority for our members. And it's been vexing and not acceptable to us that the rate of utilization hasn't gone up in recent years. Now, it's been flat, and it's probably a little higher than the statistics that have been reported in that. I think the 30% statistic in your agenda includes any family with an age-eligible child. But if they're school-age children, they're not actually need-eligible. If it's a two-parent family, we expect the second parent to provide childcare. So it may understate the rate. We know there are about 20,000 children who are they're on aid, but they're in the general child care system, and they don't show up. So that would adjust the rate some, but still the trend isn't going as high. The trend's not moving in the direction that we want either. Some of the things that I think your analysis from your staff pointed out, I think, an issue. If people show up with an informal arrangement and they get to the point of welfare to work at the time that the childcare referral's made, they've got an informal arrangement that they may continue to use. So as Ms. Johnson said, the timing of when we offer childcare, the assistance that we offer families in getting through a very cumbersome application process, and the efforts to try to streamline that application process, I think, are critical. Ms. Johnson mentioned noticing the provider at the same time that you notice a client that there's been a change in their circumstance, so that people don't drop off once they're on, because that churn is a feature of public assistance programs, and we deal with it, and I think we're dealing with it in the child care system as well. And sort of the ability to sort of return to more co-location of services. We've talked to our members a lot about this issue. We thought a couple years ago, we responded to the allegation or the concern, well, maybe we're just not telling people. And I don't think it's that. My members don't think it's that. We're abiding by and fulfilling the requirements of the law to notify people of the eligibility for childcare, and some people are taking it up and some aren't. Now I think it's a matter of best practice, and we've got to dig into the different practices that Ms. Johnson talked about and find ways to replicate them across the state. What the rate ought to be, we don't know. But we do think the trend should be going up. How high, we don't know, but we're really interested in working with the department and the legislature to put in place any practices that we can conceivably put into place to expand utilization.
Thank you. Questions from members? Senator Block.
Yeah, if I can get parochial, representing San Diego. It's long been said that San Diego historically has underutilization of social services. Want to ask, particularly with regard to childcare, CalWORKs childcare, and number one, is that true in your mind? Number two, or has it historically been true? Number two, is it still true? And three, if so, why? And four, what is the state doing about it?
I can say in terms of utilization of childcare in the CalWORKs system, San Diego's rate is higher than the state average.
Good.
Just to at least provide that context. In the general CalWORKs system, I don't know that we have additional.
Then let me ask, if for whatever areas of the state utilization might be subpar, what is the state's role in trying to lift the utilization?
Yeah, I think, again, a lot of the efforts that I mentioned related to our new site visit protocol is going to help that, because what we are actually learning and seeing for ourselves the processes that are occurring to be able to then share those. We meet with the County Welfare Department Association on a monthly basis at a minimum just to talk about childcare issues. So the ways that in which we can inform that, provide best practice in that venue, as well as additional policy guidance that we might be able to offer in terms of support to see some promising practices be replicated, again, as Mr. Mecca said, across other counties.
I think it's important to point out that most of the people who are in welfare to work who aren't utilizing childcare are participating in welfare to work. So the absence of childcare doesn't mean that they're not participating. It could mean that they could reduce a burden perhaps on a family member, or they could provide an improved childcare situation. But I don't think it's not a straight line between you didn't get childcare, so you're not participating in your welfare to work. But to the extent that we have opportunities that can make it easier for the parent or more enriching for the child, that's what we want to do.
Thank you, and I do note that, thanks to Madam Chair, San Diego has about a 35% utilization rate, which is above the state average, but still seems is not a really good number. We would hope to get that much higher. Is there anything the locals can do? I mean, is this a County Board of Supervisors issue? What would you suggest?
I think, as I said in the testimony, I think it's a matter of trying to figure out what the best practices are. San Diego County, like all other counties, are telling folks what they're eligible for. Are they telling folks at the right moment? Are they reminding them enough? Are they providing assistance to clients to fill out paperwork rather than just handing them paperwork? If a client is going to lose access to their care because something changed in their circumstance, are they telling the provider as well as the client so the provider can assist the client or at least remind the client? There are probably many others, Senator Block, ideas. It's a matter of getting those best practices identified and spread.
And then that's, as you look down the list here, there's quite a variety in utilization rates among the counties. So again, I ask, what is the state's role? You want counties to adopt best practices. What if they don't? What if they've historically not? What if they continue to, for whatever reason, not? Is there a state role in?
Sure. In the general CalWORKs system, when monitoring is occurring with counties, there's a conversation that happens in terms of any noncompliance, corrective action plans, and an opportunity to correct that. So that's kind of the process by which that happens in the CalWORKs system.
I just want to say one thing. From our member standpoint, our conversations we've had, this isn't a compliance problem. Like, this is not an issue where, with respect to the current requirements, the counties aren't complying with state requirements to notify people of the eligibility for childcare. It's a matter of, we believe, identifying what practices that we can put in place to assist and encourage clients to take advantage of that benefit that we make available to them. Like all programmatic areas, if some of those practices rise to the perceived level of efficacy that the legislature wants to mandate that practice or the department wants to regulate it, we engage you and the department in that conversation all the time and are happy to engage you in that conversation. But I don't want to sort of leave a perception that we have a compliance issue. I think we're all trying to figure out what the best practice is.
And yet, when I look at the different counties, some have utilization rates in the teens and some as high as in the 70s, it looks like. Does the state do anything to get the teens those with utilization of the teens higher. I mean, you keep saying it's not a compliance matter, so they're complying, they're just not succeeding. So what good is compliance without success?
Committee members, I'm sorry. Will Lightbourne, Director of the Department of Social Services. I'm sort of taking Mr. Bland's place since he had to step into the other meeting. If I could just sort of reinforce what I think Ms. Johnson and Mr. Mecker are saying. We've sort of instituted over the last couple of years a much more sort of rigorous process between the state and the counties of really looking at going a step past compliance and saying, what's the goal we're trying to get to with the program? What are the income benefits, the support services, et cetera, we want to attach? And using both on-site reviews, case reviews, sending expert staff into the field, also using sort of data analytics, look at who's good at what, and then sort of really building learning collaboratives and bringing people together and saying, how did they accomplish this? What led to it? That's a big part of how we've sort of been improving work participation rates in the CalWorks program. The sort of process in a parallel program, CalFresh, where we brought the 19 big counties together a month or so ago and sort of studied how have some counties reduced the churn rate to almost minimal, but others still have a problem. There really are the best teachers of each other, and I think the role the state plays at this stage is facilitating that process, highlighting it, and providing the tools to the counties. As Frank said, yes, there are areas with some of our programs where we have to intervene in a sense and say, we don't believe you're fulfilling the requirements of the program, produce corrective action plans, and we do that. But in the childcare area, I think it has been much more, we saw a downturn that occurred during the recession, during the cutback in stage 3 childcare, during the exemptions to the underage 6 population. A lot of providers left the field at that point because the fundamental underlying economy of the business had changed, and we're sort of trying to edge back up to where we had been. But in some respects, it was a self-inflicted wound.
That's very helpful. Thank you.
And just a reminder, the young child exemption was something the legislature did that basically said childcare is so expensive. If you have a child under 6, CalWorks mother, you stay home. We then reversed that years later. So we've done a start, stop that complicates matters as well. Senator, are you done?
Yes.
Senator Allen.
I know that you're not trying to leave us with the impression that there's a problem necessarily. I think the data that is in here in this report is leaving us with the impression that there's a problem. And I guess I get what you're saying about compliance. I suppose my question for maybe Ryan from the LAO is, do you think that there is something that the legislature ought to be doing with regards to accountability standards when we look at this kind of data and all the vagueness that also exists in the statewide allocation chart?
Thank you. Ryan Woolsey with the LAO. I think the legislature certainly could consider additional measures to hold counties accountable to certain performance expectations. I think one thing that will be important to consider in the context of that is that the data that's been presented does have some issues with it. There's some imprecisions. It's a little bit difficult to compare apples to apples. As has been mentioned, it's clear that there is an issue, but with respect to setting specific standards and holding counties accountable, there probably would also need to be some efforts made to improve the reliability of the data. There are some opportunities that are coming up with respect to that. The online CalWorks assessment tool was brought up. This tool asks questions about need for childcare very early on in the CalWorks process, and the governor's budget includes funding that will link the assessment tool to existing county automation systems, which should facilitate opportunities to retrospectively look back and assess whether those needs that were identified were actually met. So I guess bottom line, certainly the legislature could consider ways to hold counties accountable, but it will be important to improve the data and the measurement.
Mr. Mecca?
Thank you, Senator Allen. I think it's also important to think about accountable for what. There are people who don't take up Medi-Cal who are eligible. There are people who don't take up CalWorks who are eligible. the state has oversight mechanisms for what we're required to do. We know that they're part of the system. We don't begrudge the state. If there are actions that the state thinks the county should be taking, we want to engage you in that conversation. We're trying to look at the actions we should be taking ourselves. But to go to the point of, despite your best efforts, a client decides they don't want to benefit, that to me doesn't seem like it's a compliance issue.
No, I agree. I think, I would agree. I think ultimately, we've got to look at the effectiveness of the offering of childcare, as it said here, the appropriate time for families, and then have the counties really taken best efforts to inform people. And then at that point, if it's their own decision to not accept the services, then there's then that's fine. But is there, are we doing everything we can from the state's perspective to ensure that at least there's good information sharing? And I guess I look at these different rates, and and maybe some of it has to do with the fact that the data collection is faulty and there may be challenges, but it certainly suggests that there may be some significant room for improvement in terms of outreach and engagement. And ultimately, that's our responsibility in this forum to ask these kinds of questions and try to come up with ways to ensure that our folks on the ground who we rely on to provide this important set of services to people in tremendous need are doing everything they can to reach out and engage folks. And then obviously if it's their decision not to accept the services, then so be it. But I'm wondering out loud whether we're really doing everything we need to do. And so that's my thought on that.
And to be clear, we don't think we've figured it all out either.
And
by
what
any
I would,
stretch.
And what I would add to it is it's troubling that we haven't, I guess, for me. This isn't a new program. It's been around for quite some time. Whether the data is accurate or not, we must acknowledge the starts and stops that we have created to a system. So we've got to recognize that, but I think that it's troubling that the number's so low. It's troubling that none of us have a real sense of what the number ought to be. Because some things, the data is finite. We know how many people are on CalWORKs. We know how many people need to be transitioning into school, work, whatever the case is. We can only make assumptions about how many people need childcare based on the sheer number. So my follow-up, Ms. Johnson, is given the work that you've done in terms of the 6-county study, what's the next step? Are you going to go, is the goal to get to all 58? Is the goal to get to another kind of representative sampling, rural, urban, small, large, medium? And what's the timing for, now that you've gathered all this great data, what's the next step there in terms of rolling it out to agencies, counties? What's the timing so we can benefit for the rich data that you've collected?
Sure. So we are going to do additional visits. At some point, yes, all 58, but we'll do a sampling. So I would say that by the end of next year, we'll have a clearer picture based on where we visited of truly the best practice. But we'll start with some preliminary findings, some of which I mentioned to you today, to engage counties in that conversation, to really have exactly what I believe Director Lightbourne said, is having those learning communities to say, you're offering this emergency short-term childcare while childcare is being approved. What does that look like? What can we learn? So I think we will be bringing that to CWDA's Child Care Committee. We'll also be circling back with our clients themselves to say, would this have helped? At what point in time? Really learning from the client's experience to what might help in the process. So we see that the starting of the conversation of best practice happening as early as this summer, and kind of a continued dialogue of, again, looking at if there's policy changes that we should be making and so forth to implement within the next year of that.
Before I pass it on back to Block and Allen, which of the, who were the 6 counties you went to?
We have visited Alameda, Contra Costa, Marin, Orange, Sacramento, and Stanislaus, and we'll be in San Francisco next month and Los Angeles within a couple of months after that.
And how did you just?
We used a mix of utilization rates and county size to start with. That was the.
Okay, that's what I was going to ask, if some of the low
Marin, for
performers-
example, was one of the higher rates, and so we wanted to see what we could learn in terms of best practice from them. But we did also visit some of the rates that had a lower utilization.
Did you say you went to Stanislaus?
We did.
Okay, because I'm looking there at 19. Okay, so it was a mix. That's helpful. Senator Block.
Yeah, still on the same line, because there seems to be a disconnect here. I understand you all say some of the potential users of the service choose not to. That's understandable. But over the vast numbers that we have here, you should think there would be some point below which in any county is unacceptable. So I'm asking you, what is that point? Do you have a goal? What is that goal? If a county doesn't meet that goal, what do? If you don't have a goal, why not?
I can imagine us getting to a point like that, but to do that, we have to do several things. As Mr. Mecca referenced earlier, we have to know how many children may be in other general child care from the family group. We have to know how many children are in strictly informal care that the parent has arranged and that's what they want. As Mr. Woolsey said, as the OCAT data is sort of deepened, we'll be able to look retrospectively at who indicated a need for childcare and then link that back to where the service is provided. That's probably the sort of the critical point where we're going to try to sort of land, is there an insufficiency on the ground operation on it? In terms of saying that there, however, is a total gold standard, probably the single biggest trigger we work from is childcare is a right under the program. Therefore, are people filing requests for fair hearings, for denial of service, et cetera, or are people saying they've been required to participate in welfare to work where supportive services have not been provided? Because the counties, under some circumstances, could say, we don't have that resource at this point, therefore the client is exempt. So it's sort of knitting together those parts sort of going forward that I think, frankly, having brought Ms. Johnson and a sort of a new team on board over this past year to really sort of lead this, we need to know better what parts of this are connecting well and where we're not meeting the client-consumer demand points.
Everything you're saying makes sense and is understood, but we've been doing this for a lot of years now. Is there a goal by which we'll have this data and be, I mean, I just wonder, right now we have a situation where there are no failing counties. I mean, every county is doing fine because there is no standard under which they're failing, apparently. If a county's at, 70% or even 90%, and other counties at 18, there may be differences in the demographics of the county that matter. But we have enough counties in California, enough similar populations across some counties that we can measure, and there should be some standard for success or failure and some point where the state absolutely intervenes. And we're not talking about an individual case, because certainly there are individual differences, but in a county-wide case, that's, I guess I'm just trying to...
Not to be argumentative or quarrelsome, you must remember, the evaluation and sort of pass-fail, if you will, for counties in the CalWORK system has been sort of built into the W&I code fundamentally around, is the state exposed to penalties for not meeting federal requirements, and then under those sets of circumstances, penalties are passed on to counties in the terms of fiscal penalties and heightened sort of state oversight up to and including sanctions, corrective action, et cetera. That has not tended to go component by component. So it hasn't been denominated in terms of, and there are questions that people do ask about, are enough people getting transportation assistance or the right kind of transportation assistance, or is it timely? Child care is a huge part. Are domestic violence survivor services available? Human trafficking survivor services. I mean, all of these are part of what makes a great program. I think the consensus we have is that we have the tools in place now in California for a truly great program. And now the big challenge that counties and we have embraced and we have the teams in place to fulfill is knitting those pieces together in a way that we don't have outliers that aren't understandable. If there's an outlier, we have to be able to say there's a reason why this one is different.